Diarrhea is the condition of having frequent, loose, or watery stools. It is a common problem that can affect people of all ages and is usually a symptom of an underlying issue such as an infection, food intolerance, or gastrointestinal disease. Diarrhea typically lasts a few days and resolves on its own, but severe or prolonged cases can lead to dehydration and other complications. Types of diarrhea: acute diarrhea, sudden onset of loose or watery stools that lasts for a short period, usually less than 2 weeks. Common causes: infections, viral, bacterial, or parasitic, food poisoning, or reactions to medications. Persistent diarrhea, diarrhea that lasts between 2 and 4 weeks, often associated with infections or ongoing gastrointestinal issues. Chronic diarrhea, diarrhea that lasts longer than 4 weeks. It can be related to underlying medical conditions such as irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), or malabsorption disorders like celiac disease. Causes of diarrhea: the causes of diarrhea vary widely, but they generally fall into a few categories. Infections. Viral infections. Common viruses such as rotavirus, notavirus, and adenovirus can cause diarrhea. Bacterial infections. Bacteria like Escherichia coli, E. coli, Salmonella, Shigella, and Campylobacter can lead to foodborne illness and diarrhea. Parasitic infections. Parasites like Giardia, and Amoeba histolytica, and Cryptosporidium are common in areas with poor sanitation. Food poisoning. Contaminated food or water can cause acute diarrhea, often accompanied by vomiting and stomach cramps. Food intolerances and sensitivities. Lactose intolerance. People with this condition cannot properly digest lactose, the sugar found in milk, leading to diarrhea when dairy products are consumed. Gluten intolerance. Celiac disease. In people with celiac disease, eating gluten can trigger diarrhea and other gastrointestinal symptoms. Medications. Antibiotics can disrupt the balance of bacteria in the gut, leading to diarrhea. Antibiotic-associated diarrhea. Other medications, like antacids containing magnesium, chemotherapy drugs, or certain diabetes medications, can also cause diarrhea. Digestive disorders. Irritable bowel syndrome (IBS), a functional disorder that can cause episodes of diarrhea, constipation, or both. Inflammatory bowel disease (IBD). Conditions like Crohn's disease and ulcerative colitis lead to chronic inflammation in the digestive tract and may cause chronic diarrhea. Malabsorption. Conditions like celiac disease, pancreatic insufficiency, or small intestine bacterial overgrowth (SIBO) can lead to poor absorption of nutrients, causing diarrhea. Stress and anxiety. Stress and anxiety can trigger or worsen diarrhea in some people, especially in those with IBS. Symptoms associated with diarrhea. In addition to frequent, loose, or watery stools, diarrhea can also be accompanied by other symptoms, depending on the underlying cause. Abdominal pain or cramping, bloating or gas, nausea and vomiting, fever especially if caused by infection. Blood or mucus in the stool may indicate a more serious condition such as IBD or infection. Complications of diarrhea. The most serious complication of diarrhea is dehydration, which can occur when the body loses too much water and electrolytes. Signs of dehydration include dry mouth and skin, thirst, reduced urine output or dark urine, fatigue and dizziness. In severe cases, confusion or fainting. Dehydration is particularly dangerous in infants, young children, the elderly, and people with weakened immune systems. Diagnosis of diarrhea. If diarrhea is severe, persistent, or accompanied by other concerning symptoms such as blood in the stool, significant weight loss, or fever, the doctor may perform various tests to determine the cause. These tests can include stool analysis. A stool sample may be tested for the presence of bacteria, parasites, or blood. Blood tests. Blood tests may check for signs of infection, inflammation, or other underlying conditions like celiac disease, endoscopy or colonoscopy. In cases of chronic diarrhea, these procedures may be performed to examine the inside of the digestive tract for signs of IBD or other conditions. Imaging tests, abdominal x-rays, ultrasounds, or CT scans may be used to rule out blockages or other abnormalities in the digestive system. Treatment of diarrhea. Treatment for diarrhea depends on the underlying cause and the severity of symptoms. Common treatments include rehydration. Oral rehydration solutions, or these contain a balance of water, salts, and sugar to replenish lost fluids and electrolytes. They are particularly important for children and the elderly. IV fluids. In severe cases of dehydration, intravenous fluids may be necessary. Dietary changes. Bland diet. Eating mild, easy to digest foods such as bananas, rice, applesauce, and toast. The bland diet can help settle the stomach. Avoid certain foods, avoiding dairy, fatty, or spicy foods, and caffeinated or alcoholic beverages can help reduce symptoms. Probiotics. These can help restore the balance of good bacteria in the gut, especially after antibiotic-associated diarrhea. Medications. Antidiarrheal medications. Over-the-counter medications like loperamide Imodium can help slow down bowel movements and reduce diarrhea. Antibiotics. These may be prescribed if the diarrhea is caused by a bacterial infection. Antispasmodics. In cases of IBS-related diarrhea, medications to reduce bowel spasms may be used. Treatment for underlying conditions. If the diarrhea is caused by a chronic condition like celiac disease or IBD, treating the underlying condition is essential to prevent recurrence. When to see a doctor. You should see a doctor if you experience any of the following: diarrhea lasting longer than 2 days in adults or 24 hours in children, severe abdominal pain or cramping, blood or pus in the stool, high fever, signs of dehydration such as dizziness, confusion, or reduced urine output, diarrhea accompanied by significant weight loss or weakness. Prevention of diarrhea. Some cases of diarrhea can be prevented by taking the following steps. Hygiene. Wash your hands frequently, especially before eating or preparing food, after using the restroom, and after handling pets. Food safety. Avoid consuming raw or undercooked meat, eggs, and seafood. Ensure that food is stored and cooked at the proper temperatures to avoid contamination. Safe water. In areas with questionable water quality, drink bottled water, and avoid raw foods washed in local water. Vaccination. Vaccines are available for some causes of diarrhea, such as the rotavirus vaccine, which can prevent severe diarrhea in children. Managing chronic conditions. If you have conditions like IBS or food intolerances, follow a prescribed diet and lifestyle plan to minimize symptoms. Conclusion. Diarrhea is a common condition that usually resolves on its own within a few days, but it can lead to complications like dehydration if not managed properly. Maintaining good hygiene, staying hydrated, and seeking medical attention for severe or prolonged cases are key to managing diarrhea effectively.